another technique. If a person is, again, we'll use that example of restricted rotation to the right of the thoracic spine, so you can assess that, hands on single shoulders I call that. Rotating to the right, so if there was a restriction there, and dropping side flexion to the right. Okay, and that was different to going to this way. So this way is easy, no restriction, okay. So what we want to do again is we still want to gap the costotransverse and the costovertebral joint on the right, but what we do, left hand right shoulder, right hand left shoulder, so that's our position, same position as we use technique 1, but what we're going to use is the spinous process this time. Okay, so what we're going to do is drop into flexion. All right, so the flexing is giving us a little bit of leeway, a little bit of access to the thoracic spine. My thumb this time, rather than on the angle of the rib, I'm now running up the spine. I'm on the left side of the spinous process, so I'm running up here on the left side. And again, I'm moving down to about rib 5 now. Okay, now the same positioning. I'm stabilising on rib 5. I'd like Sabrina, you to flex further, rotate to the left, side bend to the left, and we've got a gapping going on the right, on the CT, costovertebral and costotransverse joints. Now here we go, I'm on the spinous process. I've put my finger in a little bit of a silly position there. Now I'd like you to take a breath in, so we gap the joints, and hold your breath, rotate to the right, and then relax again. Now I'm applying a little bit of pressure there, so drop down a little bit more, side bend, rotate. So you keep gapping on this side here. Take a breath in, hold your breath, rotate to the right, relax again, side bend, rotate. Here we go, once more. Take a breath in, hold your breath, and then rotate to the right. So I'm using the muscles, a little bit of resistance through the elbow with my hand at the front, drop, rotate, so 3 times. And you may want to do a little bit of soft tissue release out there as well. Again, a great technique. You need to reassess, all right, how has that worked? Wonderful movement again. And you may basically, if you still haven't got range of motion there, still a little bit restricted there, we'll do the 3rd technique.